one, and we are live.
Hello, good evening to everyone. This is Dr. Sanjay Chaudhary, and on behalf of the Radiant Division of Sun Pharma, I welcome you all on this session of the battling the second wave of Corona. Okay, so we all have seen that there is increasing number of cases, COVID cases across India, right from the north to the south, from the east to the west. And above that, there are too many queries related to the management, right from the clinicians also to the common people on how to manage this, how to handle this crisis, how to handle this lockdown. And there are multiple queries on this. To address all these queries and help us with certain queries on this, we have with us Dr. Narasimhan sir. And before we start this session, we also have with us Dr. Narasimhan sir, who is the director of the Respiratory Research Foundation of India, and is also the cardiothoracic surgeon presently attached to Apollo Hospital. So before we start the session, I would like to invite Dr. Ajay sir to say a few words on the present session. Over to you, Ajay sir.
Thank you, Dr. Sanjay. Good evening to everybody who have logged in and also those who are going to log in soon. I am Dr. Ajay. I am Director of the Respiratory Research Foundation of India. The Respiratory Research Foundation of India was founded in 2001 by Dr. Narasimhan as his brainchild to create awareness among the public about various respiratory problems. And initially, our main motto was to spread the message that TB is curable, asthma is controllable, and smoking is avoidable. So we have created this impact among the public almost 20 years back. I think we are in our 20th year of our foundation right now, being a memorable year. We have conducted so many screening camps, and we have, I think, been fairly successful in educating the general public into knowing more about these diseases. But now the talk of the day is Corona. This, as we all know, has become a household name over the past 18 months, starting from kids to the old people. They are all talking only about Corona and nothing else at homes. Just when we were thumping our chest and going about explaining to other people in the world and our cousins in the US, like saying how we have declared war and then achieved victory over COVID in the first wave, the second wave hit us right below the belt, and we have literally been affected. With number of cases rising, the impending oxygen shortages in various states, the non-availability of beds, and this second wave has really been terrible. We have reached a stage today where people are booking oxygen cylinders straight from the factory, buying remdesivir over the counter, and ordering oxygen cylinders and ventilators directly from the factory to suit their own convenience. They want to stock it up at home. They have come to such a level. But all these apart, what is the impact of the second wave over the common man in the long run? To answer these questions, we have with us Dr.R.Narasimhan, Chairman of the Respiratory Research Foundation, and I thank the organizers at Sun for giving me an opportunity to introduce this program. Over to you, Dr. Sanjay. Thank you very much for giving me an opportunity.
Sure, sir. Thank you, Dr. Ajay sir. So before taking the questions, I would just like to introduce Dr. Narasimhan sir. So Dr. Narasimhan sir is MD, FRCP and FCCP by qualification. Sir is a fellow of the Royal College of Physicians of Edinburgh and Glasgow and is the governor of the American College of Chest Physicians, South India. He is the adjunct professor at TNMGR Medical University and University of Queensland, South Australia. He has been training in interventional pulmonology and lung transplantation at Pittsburgh. He has more than 32 years of experience in pulmonology and is presently with Apollo Hospitals, Chennai. He has been involved in more than 20,000 bronchoscopies and 500 medical pleuroscopies. Sir has also been credited with starting endobronchial ultrasound for the first time in Apollo group and has been involved in more than 492. Sir has also been involved with initiating the narrowband imaging bronchoscope. Sir has been in the editorial board of multiple journals, right from Lung India, Pulmon, Chest, Indian Journal of Sleep, and is a reviewer of multiple peer-reviewed journals. He has also been involved in writing multiple chapters for textbooks on asthma, sleep-related diseases, and interventional pulmonology. I welcome you, sir, Narasimhan sir, for this medical session on the corona. So before we take the sessions, we would like to hear from you about the COVID-19 in the present stage in India.
Thank you, Sanjay Chaudhary. That was a nice introduction. And I also would like to say what Ajay said was that we started thumping our chest of victory. That I think I keep telling that we declared victory a bit too early. That's what it's proved. No? The corona has come back with a vengeance in our country. We thought we had become a kind of, we have reached a stage where we're just an endemic one. From that stage, we are in the midst of a bad pandemic where people are scared, doctors are scared, nursing staff is scared, everyone is getting infected, people are afraid. So, what is the impact of this uh, pandemic, the second wave, on our vaccination policy, on patients' management strategies, which would range from oxygen to drugs to hospitalizations and so on? And also, most importantly, I also would like to touch upon the vaccines, very importantly, why one should take the vaccine about it. Just as I was thinking about it, I was just talking to Prisam, the general manager of the Sun Radiant, as to how to take this forward. He said we'll have it in the form of a Q&A session and we'll organize the whole show. So it is going to be an entirely different session in that sense. I have left it to the Sun Radiant people to come up with questions, and as the questions pop up in the chat box, and if they are not any repetition, we'll be taking those questions. I think with this small introduction, I'd like to hand over the mic back to Sanjay Chaudhary and Preetham Kulkarni. Yeah, Preetham.
Yeah. So thank you very much, sir, for your kind beginning. So as we start, we have already some questions which have started coming in. But as you rightly said, we have some questions which are there in the mind of clinicians and the people at large. The first question that is commonly being posed to the clinicians today, what's the difference between the first? We have seen the first wave, and now everybody is witnessing the second COVID wave. So what is the difference between the first and the second COVID wave, sir?
Yeah, the main difference is in terms of symptomatology. In second wave, what we are seeing is fever is persisting for a fairly long period. So in the first wave, we had more of respiratory symptoms, nose symptoms, and the loss of smell, and the loss of taste, and some cough, and some breathlessness, and so on. And fever used to be there for a short while, used to disappear. But now in the second wave, what we are seeing is the fever is prolonged. I had patients who had fever for more than 10 days, 12 days. Their saturation is good. Other things are all good. But the fever is something that's manifesting very badly. It stays for a longer period than usual. And the another thing that we have noticed is the gastrointestinal symptoms. People are presenting with diarrheas and vomiting. So GI symptoms are also predominating, which should alert us to the possibility that if any patient is presenting with fever and diarrhea, we should not be led into a different diagnosis, but think that this guy could be having a COVID, because we kept telling in the first wave that it is a respiratory virus, and you should worry only if he has got respiratory symptoms and other
I think there is some challenge in the audio.
patients presenting with GIs. Other difference that we have noticed is the respiratory symptoms are starting a bit late. The first or the second CT scan, many people are very smart these days. The moment they are diagnosed as COVID positive, they take a CT scan of the chest and they present to the doctor, clutching their CTs in their shoulders, come to the doctor and tell the doctor himself, "Sir, we are positive. I have a CT chest with me." And CT chest is normal. But to our surprise, the respiratory signs, the CT images, start getting worsened after 10 days. That's another thing that we have noticed in the second corona wave. That is, the respiratory symptoms are getting a delay. They start appearing a bit late. That's one of the observations which I have noticed in the second corona wave.
Yeah. So just to build up on this, I mean, since you spoke about, there are a lot of changes which are happening on the CT at a later stage. So which is a peculiar of from the first case. So is it advisable that today in the second wave, as we are witnessing second wave, is it recommended that patients should do a CT in the first go itself, the moment he gets RT-PCR positive?
My answer to that is no. They should not go for a CT test in the first instance. So in other words, I would just tell what a patient should do once he is diagnosed or when he suspects that he has a COVID positive. So what he must do once he is COVID positive, first thing that he must do is to isolate himself, quarantine himself at home, and first 5 days, if there are no symptoms, he need not worry about at all. One need not rush to a CT scan and take a CT scan of the chest and present to the doctor saying that his score is only 2. Now people are all very intelligent now. So they come back and tell you my score is this much, what I should do and all. So one should not go for a CT scan of the chest in the first instance. That's my first advice. If you are positive, what you must do is you must stay back at home, quarantine yourself, take rest. Don't give much work to yourself because the more you work, the more your metabolism increases, the more the virus multiplies, and you yourself contribute to increasing the virus load. So stay at home. If you are symptomatic, if you have cough, if you have breathlessness, if you develop some symptoms which worries you, or you think you are getting breathless on a small work, and nowadays many people have pulse oximeters at home. It is available like you can buy a rice or a sugar in any shop. So you can check your saturation. If the saturation is around 92, 93, one need not worry. If it's dropping below 90, that is the time when you should go for a CT scan of the chest. Not all patients in the first instance, when they suspect that they have COVID, or if there is a person who has a COVID at home, they suspect as a part of the thing, if they do a COVID testing, they need not go for a CT scan of the chest.
Thank you, sir. Sir, now moving on to the diagnosis, one of the common challenge that has been observed is that there are multiple patients who are coming with RT-PCR negative reports, but at the same time, there are radiological changes of ground glass opacity. So how do we interpret this?
Yeah, there are two things of it. The RT-PCR test is a gold standard test. If you are positive, definitely you have an illness. But you have all the symptoms of COVID, or you are in contact with a COVID patient at home, and you have symptoms of COVID, like you have loss of smell or loss of taste, you have a high grade fever, you are in contact, you have a patient of COVID at home. If your RT-PCR is negative, and then we ask for a CT scan of the chest, and there is a justification for a CT scan of the chest in the first instance itself when the patient sees a doctor. In that situation, I would suggest a CT scan is a better bet than a chest X-ray because chest X-ray may not pick up all the lesions, all the early lesions it may not pick up because X-ray chest is a two-dimensional view of a three-dimensional picture. So if you take a CT scan of the chest, you can see all the lung lesions very clearly, and there are very clear-cut guidelines have been given to identify COVID on the CT scan of the chest, and there are also a scoring system which gives us a very clear-cut diagnosis. Which brings us to a very important point, saying that CT scan is one of the very important diagnostic tools in diagnosing COVID by the clinician, not by the patient. CT scan should not be ordered by the patient and go for a CT scan. He must always go with the advice of the physician because CT scan has its own disadvantages. Though the present generation CT scans are extremely good, the fear of radiation, the fear of malignancies, all those things are not there that much as it used to be in the early days when we had our CAT scans in the early days. Now it is an entirely different ball game with regards to CT scan. In malignancies and in follow-up malignancies, in following up, we take quite a lot of CT scans. They are not that bad. But a normal, otherwise normal individual having a suspicion of COVID, one need not go for a CT scan directly if he is positive. If he is negative, if he has symptoms, if he is in contact with a COVID positive patient, there is every justification for a CT scan because CT scan sensitivity is very high. There are definite changes that you can pick up. There are many occasions where I picked up a COVID on a CT scan of the chest rather than an RT-PCR test, which has turned out to be negative.
Thank you, sir. So the next question is about the early symptoms, because we have been hearing a lot of cases that today the patients who turn COVID positive they go for a testing little late, rather than the onset of the symptom. So what are the early symptoms which one should watch for? And if they have these kind of symptoms, how fast do you recommend them to look for the early symptoms and go for a some sort of RT-PCR test? So what are those symptoms that one should look at?
Yeah, I would say the vulnerable population is most important. If someone is diagnosed as COVID positive at home, and the elderly people at home, if there is a diabetic or if there is a post-CABG patient or there is an ischemic heart disease patient on drugs, they must go for a testing. That's what I would say. That's the only way. Testing is one of the best means of diagnosing. And most of the times, many people think I will not get COVID. That's one of the attitudes. That the denial response is very high. The more you think of it, the denial response of one of the, I think it's a felt sense of somebody, there is an economist who said, I cannot have corona. I don't think I have a corona. That attitude one should not have, because I again keep repeating, it is only the 2% of the patients who develop a serious COVID problem and they land in critical care, this thing on needing oxygen and so on. Then less than 98% of the people do very well if they're diagnosed early and they are told what is to be done, how to isolate themselves, how to take the rest, how to avoid the work, what kind of methodologies they must adopt at home. If they do that, it's good. So the common symptoms that one should watch, the common symptoms, first and foremost is, as I said, contact. If there is a vulnerable guy at home, if there is a contact with a contact, there is a COVID patient at home, go for the testing, get identified, isolate yourself. I must tell the question is, how to isolate at home. If there are 3-4 corona positive patients, if all the members at home are corona positive patients, there is no need for a separate room quarantine. They can stay at home. They can wear the mask and they can stay at home. If there is only one person who has, he must wear a mask, everyone should wear a mask. So if there are 4 or 5 people who are COVID positive at home, they can wear a mask, they can stay at home, they did not stay in separate rooms, they can use the same toilet, there is no worry for that. That's number one. Number two, the early sign is if the patient has a loss of smell, loss of taste, fever high grade, or loose motions, or getting breathless, not responding, his cough is increasing, he is an asthmatic, he is using an inhaler, his cough is increasing. These are the people who must go for this corona testing and isolate themselves. Why I keep stressing on isolation is the people who are coughing, who are talking, who are sneezing, are the people who spread the virus to others. This group has to be taken care of very well. So this spread of this disease, if it is contained, will be able to conquer the second wave much faster.
Yeah, since you're now talking about conquering the second wave, the next the weapon that we have is in the form of vaccines. Now everybody is running behind vaccines. Earlier there was some sort of a hesitancy in terms of getting vaccinated, but now people tend to they are looking at, I mean, everybody wants to get vaccinated. They are in urgent need of vaccination. So what are what is the, when is that first dose has to be given? What is the gap between the first and second dose? Can you throw some more light on this, sir?
Yeah. Before I go on to the vaccine, I want to stress here one important point at home. I was just telling about the masking at home, how they should mask. The 5 important tools I would say is to prevent this in corona. The tools that we have to prevent ourselves or to conquer the corona is, first, we keep telling mask. Number 2 is social distancing. Number 3 is wash your hands and sanitize yourself. Keep sanitizing your hands as frequently as possible. 5 is avoid the crowded places. Don't go to any crowded places. And if you are going to a crowded place, always mask yourself and go. And always live in a ventilated room. It's always good to have a good ventilation. Keep your doors open. People ask me, sir, can we use the air conditioners? So you can use air conditioner, but keep the doors open so that the rooms are well ventilated. And if you are a clinician, you are practicing clinician, have a AC on, but keep the door open, have some ventilation or at least a window open so that nothing stays inside the thing, because it has been proven that this disease is airborne too. Airborne means you must maintain the distance of minimum of about 6 feet within the distance the virus falls. But there are some small virus particles which can get attached to the small particles and they can stay in the patient. Though their population is quite small, there is a lurking fear. That is the reason why we keep telling the mask. Mask is one of the very, very important tools. And the sixth, five I said, the sixth and most important one is the vaccine, which is a very, very important tool to prevent ourselves from getting the serious COVID and also the death and also the stay in ICC. Like you rightly said, in the first phase, when we started the vaccination, there was a lot of vaccine hesitancy. People are afraid that they may develop side effects, and a lot of media reports about the deaths and so on, see side effects. And as I always say, the negative reports always gets published very fast and gets circulated very fast and keep on moving in the WhatsApp many times, as if giving the impression that more than 10,000 people have died of vaccination. Actually, it's all not correct at all. The vaccines are extremely safe. One has to take the vaccination. And as of now, there are about, we have Covishield, we have Covaxin. We're going to get Sputnik, this thing V vaccine. We're going to get, and some more vaccines which are going to get. We are going to get from US, the Moderna's and the Pfizer Biotech and the J&J vaccine. A lot of vaccines will come through. Now there is a vaccine shortage because of various reasons, which I don't want to get into the details. But it is very, very important that everyone should get vaccinated. And especially, I keep stressing that the vulnerable population is the one that must get vaccinated first. There should not be any hesitation. Even yesterday, as early as yesterday, if you take the statistics, there is a great demand among the 18 to 45 years age group for the vaccines. We have opened that COVID portal has been opened. There's a great demand in that age group. The dates they are not able to get it, but still in the 45 and above group, lot of vaccines are available. Lot of place slots are available there, and lot of vaccines are being wasted there. Why this vulnerable population is very, very important, I would say, so that the people would not hesitate to take this vaccine. The reason is the vulnerable population is one who are above 50, about 50 years, who may be diabetics, who may have some atherosclerosis, who may be on hypertensive medications, who have suffered some other comorbid illnesses like cancer recoveries or chronic renal failures and dialysis. In all these patients, their immunity is at a low level, and if these people get infected, in them, because the immunity is low, the virus starts multiplying very fast. When the virus starts multiplying very fast, mutants can arise. When the mutants can arise, usually these mutants are non-problematic. It is like a cycle wheel. If the cycle wheel has about 28 spokes, it has got. If one spoke is giving a problem, if it is bent, you need an accident. If it is bent, you can adjust, you can straighten it out and start riding the cycle. If two or three spokes create a problem, you can't ride it further. This is what happens when the virus is there. When the virus enters the system, the usual job of the virus is to keep multiplying, and our immunity takes care of it. As I said, 98% of the people have a fairly good immunity, which can take care of the COVID virus like many other viruses. They all remain asymptomatic. They don't have much of a problem. The vulnerable population, in them, the virus multiplication keeps on occurring. Like I said, most of these things cannot cause a problem, but one or two can cause a problem, and they become mutants. When these mutants starts multiplying fast and they start spreading, it becomes a problem for us. So to prevent that, the vulnerable population is the one that has to be vaccinated. Then comes a question whether the vaccines that are available now can take care of these mutants. The answer is yes for it. As I said many times, these fastly multiplying viruses, when they cause some mutations also, they don't cause much of a problem. Only some cause a problem. As I always keep telling, most of these vaccines are prepared to take care of these mutants also. And especially the Covaxin, they have mentioned now that it can take care of the double mutants also. It can take care of. It can take care of the South African virus. It can take care of a lot of other things. So we have Covishield, we have Covaxin. My advice to the people is to take the vaccine as when their turn comes. Please do not hesitate to take the vaccine. the urgency in this age group is because they are the people who keep going out and participate, and they have to work, and that age group has to be vaccinated because they should not bring back the infection to the home. So in that age group, there is a great urgency among these younger people because they want to get vaccinated at any cost. There is a shortage because we are not able to cope up to the demands of this vaccination. I think in the near future, maybe in another 2 to 3 weeks time, that problem will be sorted out because more people are coming into the market to supply us the vaccine.
Thank you, sir. So, continuing with the symptoms and vaccines, sir, one of the commonly observed query is that people who take vaccines, they have some symptoms which are similar to the COVID symptoms. So how do we differentiate between the side effects of the vaccines and the early symptoms of COVID?
The COVID vaccination, first I must tell you, no vaccine is 100% safe. Any vaccine can cause some symptoms. When polio and triple in a young child can cause fever, the COVID vaccination in an adult can always cause some fever, some pain at the side, some joint pain, something can cause. One should understand that virus, most of these viruses, whether you take the Covishield or whether you take the Sputnik V, Covishield and Sputnik V or the adenovirus, they bring down the virulence of the adenovirus and they inject and develop it. Whereas the co-vaccine is the virus itself, SARS-CoV itself is taken and they inactivate and give it. Whatever we do, what is done in them is they bring down the virulence and only increase the immunogenicity of the vaccine. So immunogenicity only is increased when the fight occurs between the antigen and the system. There is always some reaction in the form of fever and other things. But to say whether this patient is developing a COVID or not, COVID cannot be caused by the virus. That much I can tell you because the reaction is only a very mild one. It stays only for 24 to 48 hours only. But 5 days or 6 days after the vaccine, the patient develops symptoms of suggestive of COVID. This COVID only. You cannot relate this to the vaccine because I must tell you, the first dose of COVID does not give any immunity at all. There will be no neutralizing antibodies. It happens, the immunity starts raising only when you take the second shot. After you take the second shot, then after 2 weeks only, you start getting that antibodies. So only then your immunity starts going up, which means you have to take the vaccine. They have to wait for 4 weeks if it is co-vaccine, or if it is Covishield, you can take the longer interval you give, the more will be your antibody production. That's what they say. But I think 4 weeks is good enough. You must take the vaccine. After taking the second shot, 2 weeks after that only, your antibody levels, neutralizing antibody levels start this rising. So which means during this period of this 45 days, if you develop symptoms suggestive of COVID, many people are attributing this to the vaccine. It cannot be. You can never attribute this to the vaccine because the vaccine-related protection starts only after 45 days. That is why we keep telling you must get vaccinated the moment you get your chance. You should never hesitate to take the vaccine because even after the vaccination, you are not safe for another 45 days. And even after the second shot of vaccination, your protection levels, whether you take the co-vaccine or Covishield or Moderna, whatever you take, it ranges from 70 to 90% only. There is always a 10% chance of your contracting an infection, but you would not develop any serious side effects. You would not develop, you would not probably go into the ICU, or even if you go into the ICU, you would not develop very serious problems. So that is the reason why we are advising everyone to go and take both the shots of vaccines.
Thank you, sir.
So the next question is, we are seeing different levels of infections from in different geographies. Is it to do with the virus mutants, there's different strains of virus, the way we are seeing that North is predominantly a UK variant. In Maharashtra, we are seeing double mutant variant. So are the cases directly dependent on the virus strain? What is the role of strain in terms of infectivity and the number of cases?
I think the virus capability is independent of what actually it is. Depends upon the host immunity and also the local factors. That's the speciality of India. Each state is different in our. Each state is a different country in our country actually. You take Tamil Nadu, it is different. You take Bihar, it is different. You take Assam, which is entirely different. Each country has a different geography. Say, for example, so the reason attributed to the, for example, our recently conducted elections and election rallies is the cause for the increasing virus, the COVID in those places. So they identified a Bengal variant. Some time back, they said there is a Bengal variant that's prevalent now. That's because, as I said, in these places, when there is a vulnerable population, when the virus keeps multiplying very fast, a new virus, because there is no definitive evidence to say that this develop only this at this site only they should develop that kind of a problem. So each place is different. So in Tamil Nadu there were elections. In Karnataka there was overcrowding. UP there was Kumbh Mela. You have various reasons which can be attributed to that. And in some places, we have declared, as I said, Mumbai probably, there are more socializing and more. So that's why it started increasing. So the development of a disease is dependent upon the immunity of the individual. I never say it is because of the virus mutating, the seriousness is occurring. These mutants, when it happens, they are more infectious. Whether they are causing more virulence or not, is I think it will take some more time for us to say whether it has caused any serious problems or not at all. I always keep telling the immunogenicity of the individual or the antibody production capability of an individual is entirely depend on the individual, not on the virus, not on the vaccine. We do come across, I think there are a lot of people in Maharashtra too who had the double mutant infections and they have recovered also. This itself means it is dependent upon the individual immunity, not on it. So it is not geographical. Geographical, some local factors may be there, some festival, some cultural obligations where they have to mix and they have to go around. There the spread occurs. Otherwise, I don't think there would be any great difference in different regions. What would be most important is whether the vaccines would work there. My take on that is vaccines work irrespective of the mutant. You must go for the vaccination, whether you are in Kashmir or in Kerala or you're in Gujarat or in Assam. You must take the vaccines as per the schedule that has been advised.
Yes. Yes, so continuing with the same thing, sir, as you mentioned that there are geographical variations in terms of the peaks of COVID. So one of the common, most everyone wants to know one thing is that when will the second wave peak as a whole in whole of India?
Actually, there are a lot of guesses. Some of the models that it should be sometime in the second to third week. There is going to be a peaking, and then after that it will start plateauing. Because every infection has its peak and then the plateau. So they're looking at the numbers, the IT Madras and some places they have come out with some epidemic models. So the epidemic model is dependent upon the calculated models, depends upon the infections and the disease and the other factors. When they factor in, they said sometime around second or third week, we should see the peak of this second wave and then start plateauing again.
So now, thank you, sir. The next question is pertaining to the oxygen. I mean, today everybody is hearing about oxygen crisis, the shortage of oxygen. So the question is, there's one question which has come is, do all COVID-19 patients ultimately require oxygen in second wave, or it is only select few who require? What's your take on oxygen crisis today? How it can be managed?
I think the part of the oxygen crisis, in my opinion, is because of the fear that has been created in the media. It is true, there is some extent, there is some oxygen shortage is there. What is happening is a lot of people are rushing to the hospital for oxygen. And a lot of people are trying to, it is like in a flat, generally, when there is a water shortage, what most of the people do is they start storing water in the house. So because of that, what happens? The people in the 30th floor or 28th floor will not get water because the fellow in the first floor is all the time storing the water. That's what is happening with. That's what I feel. No, many people who don't need the oxygen are rushing to the hospital for oxygen, are trying to get the oxygen concentrators, oxygen cylinders, and not they have started stocking at home and they have started using it. 94 they need. So that is why there are some guidelines that are coming. I generally tell if you have an oxygen saturation of around 94%, your PO2 is around 70, 68 to 70 is your PO2. Oxygen dissociation, the physiology we say generally, if your oxygen saturation is 94, it is satisfactory for a person to be at home and rested. If he wants to work on a computer, he can work. Maybe he may not be able to jump, he may not be able to work on his gym, and he may not be able to do on his workouts and so on. But if it is 94%, and if you have symptoms of COVID, what you must do is to isolate yourself, stay at home. In a matter of time, it heals. This is the story of COVID in most of the people. But the wave and the social media network has created so much of fear about the oxygen that everybody wants. Most of the people whom I diagnose as COVID, whom I tell them to go for a quarantine, they ask me for the number where I can get the oxygen. It's not the COVID that bothers him, it is the worry of the oxygen. The fear, the fear is the key. Always, when there is a fear, you want to be natural. It is a human mind that we have to be very careful. But I keep telling, I think this audience, I will tell that if the saturation is around 94, 95, one need not worry at all. One need not run for oxygen. Only when the saturation starts dropping below 80, 90%, should start worrying whether we should have an oxygen support. Even for them, they did not rush to the hospital. They can get an oxygen cylinder at home. But where is the oxygen cylinder? Everybody is talking oxygen cylinder at home, which is not necessary. That's what I tell. The second way, one should realize people develop certain oxygen saturation drops because a lot of people, every person has an oxygen pulse oximeter now. When they come to me, they come and tell you my saturation is 98. Your routine asthmatic patient tells me 98 saturation. So in that scenario, what is happening? There is a COVID patient means they have 2-3 oxygen concentrators at home, just lying at home, not using at all. So the point I am trying to highlight is if your saturation is around 95%, one need not panic at all. The saturation will ultimately get back to normal if you isolate yourself and take rest, you will get back to normal. You can also do during that period, you can do some isometric, like some deep breathing exercises. You should not push yourself saying do some workouts, keep walking on the terrace. That you should not do because any physical exercise, you need more oxygen. In pranayams, you take a deep breathing exercise as your oxygen levels keep pushing yourself up and it also heats the lungs. As you know, the treatment for COVID is only oxygen, not anything else. So one need not think of oxygen if the saturation is around 94. You can just stay at home, enjoy watching Netflix and Amazon. A lot of things are there now. Watch new movies. Enjoy yourself. Don't put your mind to strain. Don't work from home because don't work strain your brain so that your system also gets activated. Don't do that.
Thank you, sir. So when we compare with the first wave of COVID, during the first wave, there were very limited treatment options. But in the last 1 year, there have been multiple treatment options and multiple randomized control trials on multiple therapeutic options. So how do we presently see the current treatment options that are there, sir, in India?
I think this is a question more for the clinicians. But one thing I like to stress here, the remdesivir, which is being touted as one of the most important drugs in the first wave and now also in the second wave also, we have now realized that remdesivir is of use only in preventing the seriousness or severity of the illness. And also it prevents an individual, that is, there is no mortality benefit. It only helps an individual prevents an individual from getting on to an ICU or from developing a serious problem. Which means remdesivir is not of great use when the patient has already developed a situation where the patient needs a ventilator and so on. Which means, by why I said ventilator, respiratory failure, and all these things are, this group is only about 2 to 3% of the population of the COVID that gets affected. 97% of the people is doing extremely well. This 97% of people Probably out of them, only about 2 or 3% may develop a category B disease or a category B1 disease who might need a remdesivir. Rest of them may not need remdesivir at all. Many people would recover without a remdesivir itself. But there is a big clamor. We have created so much news about remdesivir. There is a shortage. It's available in this place. It's available only with this company. Luckily, Preetham does not have with him remdesivir. Otherwise, I would have called him. So many of my VIP friends called me, Doc, I want remdesivir. I want to stock remdesivir. I tell you what, stocking remdesivir. You don't have COVID, and even if you get COVID, you don't need remdesivir at all. Remdesivir is needed only in some select group of patients. So that we have realized over a period of time that remdesivir is one of the drugs which is not the be all and end all of COVID. A lot of other oral drugs have come into the market for a category A disease. Whose use is it really useful or not? We still don't know, because, as I said, most of the people recover without anything. Think of people in peripheries and villages where they don't have access to any of these drugs. They don't have an access to remdesivir. They have all recovered. I think for all you know, many people would have had COVID in that wave, in the first wave also, or also suffering from in the second wave also. They are not coming to hospital. But only in these urban areas, there is a big clamor for a remdesivir. There are a lot of other drugs which are, we call them in the form of experimental treatment. There is one drug which is showing some promise, is the tocilizumab in severe category C COVID. We do use tocilizumab. That also for category C only. It's a very small percentage of people who are getting it. That is in a tertiary care hospital, the need for these things come. Otherwise, what is the treatment of choice for these people is quarantine and isolate. As I said, what you must do as a good citizen of India, if you are diagnosed as COVID positive, is sit at home, don't do anything, don't go to the doctor with a CT scan. Because if you go to the doctor with a CT scan of the chest, what is happening is you are coughing, you are carrying with you the viruses, you are spreading the virus in the atmosphere, the milieu is becoming virus prone. Come to the clinic and wait in the clinic. And also with that, you enter the doctor's room. That is, you are carrying all those things. If you are diagnosed as a COVID, just sit at home, relax. First 5 days is a crucial period where most of the people recover completely. Half the problem of COVID is created by the fear, the panic that causes and that rushes the patient, run from hospital to hospital for a bed, make phone calls frantically for oxygen. I think this thing, many people, that habit change. COVID, I would also include in the COVID appropriate behavior, not to call people for oxygen, not to call people for, we say we need the social distancing, hand sanitation, and the masking and other things. We also can include not to make frantic phone calls for a remdesivir, not to make a frantic phone call for oxygen cylinders and oxygen and so on. Not at all necessary for that. That call can be handled by the doctors when it is needed. Most of the problem I say is the Google. They Google and get some information and it worries them. I have had patients who are coming and telling me the Google tells fibrosis is a bad thing. COVID fibrosis, interstitial fibrosis, so much of information available there. I tell my patients sometimes, because of the Google, the beneficiary is a doctor, because they keep coming to the doctor quite frequently, and doctor orders a CT scan, they get a CT scan test, and they undergo other costly investigation because they want to be ruled out of any serious problems. So the treatment aspect wise, we have realized that it is the rest and the oxygen. And if you have a serious problem, you must go to your hospital to get treated. And the drugs wise, as I tell you, there are not many drugs for COVID. Most of the drugs have not proven to be very useful. There is recently we have seen one drug which they have mentioned yesterday, the DRDO drug. The data is very small, but as I said, it is a promising thing. It's a safe drug. It is a harmless drug. Yesterday, I was just talking to one of the listening people that any safe drug that is harmless, any drug, safe drug, any drug that is harmless and which says is useful for a COVID, we can always try it. Nothing wrong in it, because we are clutching at straws. We are trying to find a good antiviral drug for a COVID. The search is on. It is 18 months since COVID has started. We are yet to find a good drug. We started from chloroquine to a lot of monoclonal antibodies. We are still in the process of searching for a good antiviral drug. The one that we have realized that works good for the patient is rest and, if necessary, in oxygen, and stay back at home. There are a lot of other things like your multivitamins, your zinc, your selenium, vitamin D. They're all of not direct antiviral drugs, but they help improve your immunity. Your immunity goes up. Probably if all the people start taking this, maybe the third wave can be conquered. Peter, you were asking before this start, how can you prevent the third wave? I think maybe this vitamin Ds and vitamin Cs and all these antivitamins, if they start taking, they'll improve one system of Ayurveda is there. That system of medication, they keep telling you take milk with haldi, they keep telling. They all are natural resistance boosters. These resistance boosters would only prevent them from getting the infection. Maybe the third wave may not be as virulent as we expect it to be. It's a wishful thinking.
Thank you, sir. So since we're talking about drugs, I mean, a lot is discussed on the steroids, role of steroids in the COVID management. So would you like to throw some light on where to use steroids, how early to use steroids?
Fantastic question, Pritam. So there was some time back there was a paper. Once it came that steroids are the best drugs for COVID, everyone started using steroids. There are a lot of steroid is a double-edged sword. It's an excellent drug. In the sense, it in category C patients, in severe COVID patients, it reduces the inflammation if you give it for a period of 10 days. But what has happened is these steroids are being misused in very mild COVID cases. In very mild COVID cases, if we take steroids, what will happen is it will have a lot of side effects. They will develop the side effects. What are the side effects they can develop? As I said, most of the symptomatic patients are in the age group of maybe from 30. First, we said it is 50 and above in the first wave. In the second wave, we're also seeing youngsters getting this. That is from 30 to 60 age group. So, say a person who is around 40 years, who is a diabetic, who is on anti-diabetic drugs, a mild COVID he develops, and he started on steroids, and that too it's a pretty high dose of steroids people are taking nowadays. And I would say even if it's a very mild dose of steroids, if he is a diabetic, his sugar levels pop up. When the sugar levels go up, it makes him prone for a lot of other infections. The other infections, in the sense, some of these fungal infections can come up, some of these bacterial infections can come up, and if the infections come, they don't heal that well. So that they are the problems of steroids, which means steroids are not to be used as a routine in all COVID infections. Then what should you do? So my advice is for such patients is not to use steroids. If they are started on steroids, consult a pulmonologist or an infectious diseases specialist whether he needs to go for a steroid. Because now everybody is the different. You asked about the difference between the first and second. The first question was that now the different. One of the difference I would say is in the first thing, many doctors closed their practice. They were not practicing at all. Out of sheer fear, they were not practicing. Now we know you can be safe by wearing a mask. You can wear a N95 mask and practice. You can wear a PPE kit and practice. On steroids, it becomes sometimes, as I said, it's a double-edged sword. So such people, when they start on steroids, it's always better, I would say, if it is something where category B or C, they should always get the advice or some specialist advice whether we can start these patients on steroids. So steroids is not a good drug for category A and category B and mild or moderate cases. But if it is a severe case, how do we identify that? You can identify it when the patient is getting breathless, he's not doing well, and you have done a CT scan of the chest. Your GP has ordered a CT chest, and your CT chest is showing a very severe disease. That is a time for you to go for a steroid. But that's only under the supervision of a physician or a pulmonologist or an ID specialist. So steroids are not a routine drug, though they are considered to be one of the best drugs for COVID in severe phase. I must add here that it is not an antiviral drug. It only takes care of a dysregulated and a disjointed inflammation that occurs in a post-COVID situation. The inflammation goes haywire. There is no predictable response in these patients in category C. It goes haywire. So we need to tackle that inflammation. To tackle that inflammation, the best drug is steroid, not in the mild phase or in the very moderate phase, where you make them prone for other infections and you have other problems along with COVID.
Thank you, sir. Sir, for adults, we have multiple treatment options as well as vaccines are now available. Now, the next question that is coming up is related to the children. So there are multiple queries like, are children at equal risk or higher risk compared to the adults for getting infected, and how is the prognosis in these children for COVID-19?
As of now, children do not develop serious COVIDs. They develop asymptomatic infections. They don't develop much of symptoms, and they can be spreaders also if they, because that spreading occurs when they play, when they talk. During that period, they can spread it to the elder listening people. Otherwise, children are not big sufferers with regards to the disease, and most of the children develop an asymptomatic thing only. And having said that, I'm also worried about the children. I must add here, it's more than 18 months since children have gone to school. And all this online education and all is available only in urban areas. So most of the children in urban areas itself are developing symptoms of childhood psychiatry like irritability, anxiety, school, because it's a habit which you inculcate in our children. No? Say a pre-KG is a habit you inculcate at a very young age, go send them to the nursery, send them to the school and so on. That's almost gone now. So people who are in LKG, UKG now, they are given automatic promotion. They would expect that every year. That's one. Number two is, if you go to the peripheries, no online education. Suppose I'm in Tamil Nadu, I can tell you near Vidupuram, some village, if you go there, what online education they can have for these children, they can have net facility, all these things. So which means the problem of COVID is not just in children, it's not going to be COVID. My worry is about the children, how they are going to grow. Sometimes I wonder, I was suggested sometimes, though they should not have crowded summer camps, they should have camps and shifts with spaced out. The children should be exposed to some kind of a schooling in shift system. If the schools can agree to that, if the governments can agree to that, I think it is time that we start attending to children's problems in a different sense, not only from the COVID angle, because we are that there is going, the third wave is going to be in children. That's what someone said. But I keep telling, if we can increase our vaccination drive, I think which might happen maybe. I'm a born optimist. Another 3 or 4 months it is going to happen. Another 2 or 3 weeks is going to happen. We're going to have a glut of vaccine. That's what happened with N95. That's what happened with PPE kit. We didn't know what N95 was when the COVID came to India, but we became exporters. Now, of course, the difference is we are importing now because we are short of it. But in matter of time, we will learn the techniques. I tell always the IT, we help the whole world regarding the changeover from 2000 to 2001. So many of our BSc mathematics and BCom math people became expert IT guys. If that is so, the same thing would happen even for us also. In a matter of time, we are going to solve this problem. So which means, if all of us, if the vaccination drive is going to go up by leaps and bounds, definitely there is going to be a very big immunity that is going to happen among the adults, and the children may not suffer that much because you are targeting your vulnerable population in a very big way. As I said, when that is taken care of, and the 18 to 45 is taken care of, children, even if they have an asymptomatic infection, the adult might develop a mild disease and then go off with it. He may not need an ICU care and so on. It is time that we take care of the children and their education. Apart from the COVID, there is something else beyond COVID for the children. You must look into that.
Thank you, sir. You did mention about the COVID patients. When they come to you now, they come with some sort of a data on saturation levels. So they keep monitoring the saturations level when they are home quarantined. So what's that ideal frequency in which we should look at the saturation levels? How frequently one should monitor?
If you ask me, I think it is each doctor has his the guideline wise. It's enough if you just check it every 4 hours or 6 hours. I keep telling my patients, only if you are breathless, you check once in the morning and once in the evening. You keep checking it because you put it itself is a tension or anxiety goes. His pulse rate is high. When the pulse rate is high, you'll immediately call the doctor. My pulse rate is 120, saturation is 94, 95. I tell him, don't bother about it. So I tell him, you do it every 6 hours. You are at home. Home quarantine is only once in 6 hours saturation, or twice a day if you are otherwise normal, if you don't have any other symptom. If you are one of the asthmatics or you are one of those COPD patients who are likely to have problems, who are sometimes on oxygen and other things, those patients should keep checking their saturations every 6 hours, not as a regular for many of the patients. Though we keep telling happy hypoxia is one of the features, it is happy hypoxia only. Not all happy hypoxia patients worsen and go on to develop a serious problem. Every 6 hours is good enough for these patients.
Thank you, sir. Sir, there's one question which has come. Besides, if a person has tested COVID-19, are there any necessary blood tests that needs to be conducted? Besides,
not all patients. So this is another thing, you know. Many people, the moment they are diagnosed as COVID positive, they go to a blood test. They have what's called a COVID panel. They get the COVID panel done, and they come and see you, and which has all the blood tests, your complete counts, and your interleukin levels and ferritin levels. You ask, many patients are very, very intelligent these days. They themselves tell, my D dimer is this much. What should I do? Should I worry about the D dimer? And all these things. My general advice to them is, an asymptomatic COVID patient need not go for any of these high-level blood tests because they are only acute phase reactants. They do not mean that they have a disease. Okay, then you might ask, when should you do the blood test? That will be a better question. Then should all patients go for it? When you should do is, in most of these COVID reports, when you do an RT-PCR test, you have what is called a cyclic threshold value. CT value is mentioned below. It's not a radiological CT. In the blood test report, when they do a not blood test, nasopharyngeal smear, when they make a mention the COVID is positive. Below that, they make a mention it is your CT value is this much. The cyclic threshold value is inversely proportional. That is, the lower the cyclic threshold value, higher the viral load. If you have a patient who is a diabetic or who is in a vulnerable group of with comorbids, his IL-6 values are low. That is, they are given each lab gives a coding that 12 to 6 severe, mild, moderate, they keep it. If it is a very high viral load, means these patients should go for markers, because with these markers, you can identify whether their inflammation is disjointed and dysregulated and is going haywire. We can identify that if a high IL-6 value or with a high CRP value or a high D dimer value, they are likely to develop clots, they are likely to develop problems. So such patients need to be observed more closely than routine patients who has a COVID positive, whose cyclic threshold value is 24, is asymptomatic, he goes for these tests, and IL-6 is 35. Sir, IL-6 is very high. It makes it nothing, because any acute phase reaction, any inflammation can go up. Only when you have a low viral threshold with a high inflammatory markers, they are the patients who are to be watched. So which means blood tests need not be done as a routine in all COVID positive patients. Only select subgroup of patients only need blood tests to watch whether they are likely to develop any serious symptoms.
Thank you. So there are a lot of patients today are on home quarantine. So at what stage or what kind of symptoms onset they should watch for, and then they will should be decided that this patient now needs to be admitted. So what is that time when one should think of considering the hospital admission?
You see, I divide this generally. What I tell my patients, there are when you have COVID, there are two things. First is the viremic phase. Okay, during that phase, if you have mild symptoms, you can be handled. Your fever can be handled with antipyretics, and all these antibiotics and all. Many people come with azithromycin, doxycycline, all these things. They are all antibiotics which are not been proven of any value at all in COVID, but they prevent secondary bacterial infections and so on. They have all finished it. They stay at home quarantine. They don't have a problem. When we should think of hospitalizing means it is the oxygen saturation. If the oxygen saturation is quite low and he's worried and it's dropping to 85, 84 and below 90 quite consistently, it is dropping and he himself is feeling breathless, sometimes they get blood stains sputum with breathlessness. They are the people who should go for this. They should think of admission. They must come to their emergency team. Each hospital has a designated COVID area or emergency area. There they must go and get checked up, and the assessing team has to decide on whether he needs to be hospitalized or not. That hospital depends upon only on the oxygenation. Only when the oxygenation is low, only they will be asked about the biochemical parameters and things would help. So they can be in home quarantine, and if the saturation is above 90 at rest, 92 at rest, 90 to 92 at rest, I don't think he should worry about hospitalization and so on. Just because someone says he has become serious, but one need not have that kind of a fear at all. You must always be very positive, thinking that you are in this 98% of the group who do not develop any symptoms, who develop just like that, who improve just like that.
Thank you, sir. So there are multiple questions on vaccination, sir. So I would like to summarize the two questions. One is uh, there are multiple patients who have got infected with COVID-19 after the first dose. So the query is when to take the second dose. And the similar question on vaccination is like, if a patient is not able to get the second dose because of the unavailability, after how long can they take the second dose?
The first question is, if you develop COVID,
yes, sir, after first
you take
dose.
the first shot, you
yes.
develop COVID.
Yes, sir. And
right.
So after how many days you take the second dose after recovery?
So when you get COVID, it becomes a first shot, and then the COVID, it becomes a booster for you, actually. So 2 months after that, you can take the next shot. You can go for the vaccine, because there will be some, once you get a COVID disease, you would have sufficient antibodies in your system, which can give you protection for 5 to 6 weeks. But then sometimes you have asymptomatic COVID infections. They don't even know that they had COVID. No? Sometimes it happens like that. In them, antibodies may not develop at all. They just have one sore throat, and they just do one COVID testing, and they find positive, and they don't come to us. They just quarantine themselves at home. In such patients, there may not be much antibodies, but so we generally say it is 1 to 2 months is the time which you can take after the COVID disease. What will be different after the second? The timeline is very, very important. After the second shot of COVID vaccination, when you're taken the second shot of COVID vaccination, it takes about 15 days, I said, for the antibodies. If within that 15 days period you develop a COVID disease, that becomes like a booster again. You have to wait for 1 or 2 months for you to go for the next shot. So it is the timeline that is very important. We should not attribute this to the COVID that you have, COVID vaccination that you have.
Dr. Ajay, sir, you want to ask any questions, sir? Yeah, Mr. Pritham.
Can you hear me?
Yeah, Ajay.
Yeah, so sorry, some connectivity issues here. See, so we all had an excellent discussion from various topics and all that. I think most of the questions which I had in mind have also been answered. But right now, from tomorrow, at least in our state, the much awaited lockdown has been imposed in Tamil Nadu. Each state is having a lockdown on its own. There is no particular thing. It is not a national lockdown like we had last year in the month of March 21st, 24th. Around that time, we had a national lockdown, and we were applauded for it. There are some parts of the people who were completely against it. Now, from tomorrow, we are having a lockdown in Tamil Nadu. Is it going to be useful? Number one. And if so, what all do you think the lockdown should encompass? Because still some shops are open. The clarity about the mobility of private vehicles still is they are not complete. So that's why, is it going to be useful, or what is your take on that? Is it going to be useful in reducing the number of cases after 2 weeks?
Yeah. If you ask me to give a political answer, I would say you should have a lockdown. If you want me to, scientific answer for that question will be, lockdown is scientifically is useful in cutting down the transmission. It definitely cuts down the transmission of infection, because you are stopping people from going to shops from going to places where they should not go, other things. But why I say lockdown is not the solution is lockdown, we are insisting on it only because we are not having a COVID appropriate behavior. That means our COVID appropriate behavior is very much wanting not only in our state, in any state for that matter, it is much wanting. We are seeing in Kumbh Mela people jostling with each other, having a bath. So when you don't have an appropriate COVID behavior, there is no other option for the government uh, but to do go for a lockdown only. But when we do the lockdown, I think it has to be complete. That's what I personally feel. It has to be a complete lockdown so that people do not move about. They stay back at home only when they are ill. Only they just go out and have an interaction and get advice from people and come back. So lockdown, in my opinion, is useful only when people stick to it or when the people are not sticking to the COVID appropriate behavior. Because this is not a solution. You're going to have a third wave. You do lockdown again. You're going to have a fourth wave. Lockdown again. That means in a year you will have 5 lockdowns or 6 lockdowns in a year. I think it's not good for it. That only reflects badly of um, um, our people. We are also a part of that actually. Our resisting capacity not to resort to this COVID appropriate behavior, which means lockdowns have to be prevented. I think we should have another big this thing on lockdown itself. How useful is lockdown? So lockdown, COVID, no appropriate COVID appropriate behavior means lockdown is the only solution. But the lockdown is not a good solution because for a person, that means as a community, we are not following the mask, we are not following the social distancing, we are not hand washing and sanitizing, we are not avoiding crowded places, we are not we are having a ventilated places. So that is why the lockdown is coming into being. And as I say, COVID is going to stay with us. It is not going to disappear just like that. There cannot be a zero COVID strategy anywhere in the world, though many countries have said, Lancet sometime back said we'll go for a zero COVID strategy. It is not possible at all. COVID has come to stay with us. As I said, there is going to be a third wave, there may be a fourth wave or a fifth wave, and lockdown is not the solution. The solution is vaccination and also the COVID appropriate behavior. That is the solution, not lockdown.
So do you think we as a society have become COVID complacent and we are not like in the earlier wave, if you see, everybody was afraid and they used to visit the doctor immediately after symptoms. Here, do you think we become complacence has creeped in at the patients?
No, I wouldn't say we have become. Nowadays, a lot of people are visiting doctors for COVID. There is no, it is not.
No, is it early? Because they come, from what I hear, they come in late. Is it because they give a trial of self-medication and then come to the doctor, or is that there or no? It's not like that.
I don't think that's happening. People are very vigilant. They know that they are having. They must go to a doctor. It's other way around. There is an oxygen shortage. There is a hospital bed shortage.
They're too proactive.
People are aware that they have COVID. That is not the this thing problem at all. So now the problem is one of over information. So again, the answer is if you must shut down your WhatsApp, you must stop watching your WhatsApp. If you keep watching the WhatsApp only, it keeps telling that oxygen saturation, this patient died. Someone says that the COVID vaccination can cause a mild COVID disease. I don't know what he means by that. A mild COVID disease can cause a thromboembolic storm. A lot of things which are not necessary. Too much of information and more confusion. So my good advice to people is to stop watching WhatsApp with regards to COVID. If they do that, I think 60% of the second wave can be contained. I think too much of a this statement this is, but I can tell, because if you can have 80 questions on a impact of corona, that means what does it mean? It means there is so much of information that is available in the social media. It's good. People should know about it. There is no doubt about it. But it causes more fear than any good among the people. And so my honest advice right from beginning is stop Googling, stop watching WhatsApp. It is the job of the physician or the pulmonologist to decide what is good for you. Like in many other diseases, we have conquered many diseases, but this COVID is proving to be a big problem, which I've been telling from the beginning, because of an excessive information that's available in the media. And as I said, excess of information that is not necessary. A lot of information, negative information is over. Negative information gets faster. If someone says the virus was manufactured in Wuhan, means we can have several forwards in it. Wuhan virus. Yes, China did. We don't know. We don't have any evidence for that. So, but we can keep talking about it. Similarly, if there is one vaccine death in one clinic, he just falls down dizzy. That's it. It can go on. Somebody can take a photograph. Can go on the WhatsApp. So, such information, I don't think one should give much importance to that. They must heed the advice of their general practitioners and physicians and pulmonologists and the infectious disease specialists. I think they are the people who are to be consulted and who have to decide whether one needs a drug or oxygen or a hospitalization and so on. That will be my, I think, the final message to the people who are
Yeah,
watching
I
this
think you
program.
answered my other question, which I wanted to ask. What the message for the common man? I think that your last answer sums it all. What the common man should follow in this particular instance or in this particular situation of the common
Only
man.
one answer for that. Stop watching WhatsApp.
I mean, I
Go
think
to your
all
doctor.
social media is flooded. So I think maybe you should regulate. Maybe you can't stop watching. I think the better word would be to regulate your social media.
I don't think it is possible. That's what I said. No, COVID appropriate behavior does not mean, I was telling it, does not mean only masking, hand washing, sanitation, social distancing, avoid crowded places, stay in well ventilated rooms. Stop watching WhatsApp. Stop watching Facebook. That also should come into the COVID appropriate behavior.
True.
Only then, we'll have a better society and a fearless society to live on. Otherwise, we are in the fear of a pandemic. Everybody is afraid of this thing. This is all. Yeah.
Sir, although there are multiple queries, sir, but we have run out of time. And sir, I would like to thank you for taking and addressing so many queries. Before we conclude, if you want to put in your final comments, sir.
Yeah, my this thing is final take-home message is vaccination. That's the best tool that we have now. We don't have any other tool with us. The only tool that we have with us is vaccination. And just go for the vaccination. And do not be depressed if there is a vaccine shortage or something like that. It's a matter of time. And we as Indians are always very good at waiting. And we will conquer this disease with ease in a matter of a month. I think June next month, I think if we have a webinar, we are going to talk about how we have control, like we had one in January, how we have controlled the disease, how we brought it to an endemic level in our country, how we have brought it down. Similar situation might occur in our country too sometime in June. So that can happen only if one goes for the vaccination when his turn comes without any hesitation. Do not ask if it is a Covishield or it's a Covaxin, which is good, which is bad. Can I take this? Can I take that? What should I take? What if there is a shortage? If there's a shortage, wait and take it. If you're getting a turn, you don't have a Covishield, you have a Covaxin, go ahead and take Covaxin. Don't wait saying that Covaxin is good for double mutant, Covishield is not good for that. Not at all like that. Any vaccine gives some protection to the range of 70 to 90%. There is a protection there. The antibodies are produced. It prevents you from getting a serious disease. So go for the vaccine. Never hesitate to take the vaccine. Even in the vulnerable population, if there are youngsters at home, they must coax their elders to go for the vaccination. That's my final take-home message for the people who are watching this.
Over to you, Mr. Preetham. Would you like to conclude the session?
No, I think just want to thank Dr. Narasimhan and Dr. Ajay Narasimhan, both of you, for sharing your valuable thoughts. Dr. Sanjay, I think we can conclude if there are no further questions. Of course, you said there are a few questions because of paucity of time, we can't take.
We'll come to the end of the session.
Okay. So thanks everyone. Thanks Dr. Narasimhan sir, Dr. Ajay sir, Mr. Preetham, for everyone for joining this, and also all the audience for logging in to this session. I hope this was very helpful. We have received more than 80 questions and we have tried to address them, but due to, as Mr. Preetham had already mentioned, due to the paucity of time, we couldn't take all the questions. Maybe if required, we can conduct one more session, but at the present, thank you all. Have a great end, and I would also like to thank the backend team for supporting this, and have a great day ahead. Thank you all. Once again, from the Radiant team of Sun Pharma, I thank you all for joining this session.
Thank
Thank
you.
you.
Thank you, Pritham.
Thank you
you.
very much. Yeah.
Thanks.